Hi everyone. I will walk you all through a topic today. The title is Revolutionizing Healthcare with Virtual Reality (VR). A quick introduction about myself. My name is Anil Naik. I'm a product lead based out of Silicon Valley, California, and I'm affiliated with Georgia Tech and UC Berkeley. All right. So we'll be covering a few areas today. We'll start by introducing the VR technology at a high level. We'll talk about some of the applications of VR in healthcare. Then we'll dive deeper into understanding the technical challenges as it pertains to real-time VR, which includes real-time communications and wireless challenges. Then we'll talk about some of the proposed solutions before concluding the presentation. Right, moving on to section 1, Introduction to VR Technology. Over the past few years, we've actually witnessed an astonishing surge in its adoption across diverse domains, whether it's transforming how we experience entertainment to reshaping education and its application in healthcare, engineering, military operations, and so on. So VR is positioned to revolutionize how we interact the world around us. As we dive into this presentation, we will double click on the third area listed on the slide and try to understand the transformative potential VR holds in the field of healthcare, but also dive deeper into some of the challenges that exist today in the terms of wireless communications and how that affects VR technology and some of the proposals to overcome these. And before we dive into telemedicine as an area, generally, what is the potential of VR? So, there are three broad areas in which we can summarize why VR is helpful. One is better quality. We talk about immersive experiences. VR has the potential to create deeply immersive experience, and that totally changes the way in which you consume information. Second, better output. Anything that you do on VR, you're essentially and effectively increasing the rate of education, the rate of engagement, the rate of learning that reduces time and improves efficiency end to end. And for an application like healthcare, this is very pivotal for anybody involved in this industry to utilize this to their advantage. The third is better outcome. Any kind of technology that helps engage the user better leads to higher engagement, and that higher engagement leads to personalized experiences and improved outcomes in different domains. Now we'll move on to section 2, which is applications of VR in healthcare. Now let's zoom into the powerful application of VR in healthcare. The impact is actually pretty profound and extends from diagnostics to treatment to rehabilitation to training and a lot of other areas. Imagine a scenario where doctors can actually simulate surgeries before performing them on live patients, or patients can undergo virtual therapy sessions digitally. VR provides realistic scenarios, reduces the risk, and enhances the patient outcomes in the long term. Healthcare professionals can actually hone their skills in a very controlled and safe environment as well. This is where the true transformative power of VR shines. In other words, the immediate impact could be seen across these three categories. First, think about rehabilitation programs. A VR based rehab offers personalized and engaging experiences for their patient, which is customized to their needs. Second, professional development. Healthcare professionals refine their skills in a very safe and controlled environment without having the risk to indulge in anything else risky for the patient. Third, safe learning environment. VR creates a safe learning environment for healthcare professionals who practice complex procedures and scenarios. Now, with the introduction out of the way, let's dive into the actual crux of the presentation, which is section 3, Talking about the technical challenges in real time VR telemedicine due to wireless tech. Navigating these wireless challenges is pretty integral to realizing the full potential of VR in telemedicine. And the next frontier involves innovative solutions and collaborations to ensure a robust, secure, seamless integration of VR tech into a healthcare landscape. Alright, now let's dive deeper into the technical challenges in real time communications. At a high level, we can actually bucketize the challenges into five key areas. The very first one is around latency and bandwidth requirements. VR applications, by its very nature, are actually pretty high in data rates, and they do demand low latency to ensure real time interactions. High quality medical VR experiences would require significant bandwidth, and that poses challenges in scenarios with limited network resources. This will hinder as a big challenge when you're executing on deploying VR technology in telemedicine. The second area of a challenge is around mobile mobility and connectivity. Patients and healthcare professionals need the flexibility to move within a VR environment. Maintaining stable wireless connectivity within a building, within a room, or within a mobile van would strictly be dependent on the network conditions, and that becomes essential for uninterrupted telemedicine sessions. Yeah, the third challenge is around security. Wireless technologies have had the been infamous for getting intercepted signals from cybersecurity hackers, and especially when it comes to an application like telemedicine, the implications can be pretty severe. Wireless transmissions, they usually raise security considerations, and if you're dealing with sensitive health data, then that's going to be pretty tricky for us to deploy. Robust encryption authentication mechanisms are extremely crucial to safeguard a patient information. The fourth challenge is around interference and signal quality. The unfortunate setting in this day and age is that there are at least a dozen devices in whichever room you're present in, and this includes hospitals and telemedicine areas. If there are so many devices in a given setting, it is bound to have cause interference and drop in signal quality, which would directly affect the audio and video quality of transmission and reception on the VR headset. This is not ideal at all for a physician or the patient who's on the call, and would severely affect the overall experience. The last challenge we talk about very frequently in an ever so innovative world is device compatibility. There are several manufacturers who manufacture VR devices. There's several software companies who manufacture operating systems and applications that run on those devices. Until we hit a connectivity standard that requires a certain level of latency, a certain level of bandwidth, and a certain level of quality of experience, it'll always be difficult to accomplish all devices operating in a certain fashion for us to execute on this vision of VR technology. Now let's move on to section 4, where we have a set of proposed solutions for some of the challenges listed earlier. These proposed solutions aim to address the wireless challenges in VR telemedicine, emphasizing the need for a holistic and adaptive approach. It involves leveraging cutting edge technologies, optimizing existing infrastructure, and also ensuring robust security measures to create a seamless and secure telemedicine experience. So let's dive in. For the very first challenge around latency and bandwidth, there are a couple of ways in which we can mitigate the challenge. First, we can introduce edge computing platforms. Deploying edge computing resources to process VR data means that you're actually not hitting the server in the back end. Instead, you're utilizing the edge computing benefits and you're reducing the overall latency involved. Similarly, we can deploy adaptive bitrate streaming. Having a high bandwidth requirement is very clear for any VR application. However, in terms of congested environment, you have to deploy an adaptive bitrate streaming mechanisms in order to avoid losing packets or deteriorating the audio and video quality in order for the user to continue with the session. On the second challenge of mobility and connectivity, there are a couple of things that could be done. Introducing 5G networks will certainly provide high speed, low latency, and will enhance the mobility within VR environments. This requires high capital infrastructure development and infusing and incorporating alignments with vendors and businesses that deploy these hardware. Secondly, there's the concept of wireless mesh networks. Establishing mesh networks to extend coverage and maintaining connectivity even in dynamic and mobile healthcare environment would go a long way. On the topic of security concerns, the real-time operating software on the VR headset needs to implement end-to-end encryption. This is the only way in which you can secure the sensitive health data that is getting transmitted over the air. Similarly, an introduction of biometric authentication will go a long way in ensuring that the right user has the right access. On the challenge of interference in signal quality, we have already listed out multiple techniques and mechanisms to reduce the interference in the paper. At a high level, listing out a couple of bullets to communicate the point. Firstly, there's a concept of frequency optimization. The wireless VR headset should be capable of communicating on frequency bands that are non overlapping with the adjacent devices in the vicinity. This way, you could reduce the amount of interference when you're communicating over the air. Similarly, there are mechanisms called dynamic channel selection. This is something that could be done at the MAC layer or the physical layer where the device is very uniquely transmitting and avoiding interference from the adjacent devices. That increases the overall signal quality. Yeah, the last challenge around device compatibility and standards is beyond the scope of one manufacturer. The idea is to have an open standards adoption, very similar to that of Wi Fi. However, it has to have a maintained quality of service. We encourage the adoption of open standards in this space, especially for medical VR devices, to ensure that there is interoperability and consistency when it comes to behaviors amongst devices. So let's move on to the section 5 conclusion. So, as we conclude our exploration into the fusion of VR and telemedicine, it becomes pretty clear that the amalgamation of these technologies hold immense promise and potential, but it also comes with its own set of challenges. We have navigated through the transformative potential of VR applications in healthcare, and we also touched upon the intricacies of wireless communication within telemedicine. We also discussed the challenges and solutions, which included usage of edge computing, 5G adoption, encryption measures, and several wireless link layer optimizations to foster better interop. In closing, the fusion of VR and telemedicine is not just a technological convergence, it's almost like a transformative force poised to redefine healthcare delivery. As we stand at this intersection of innovation and healthcare, I think we all should envision a future where the immersive technologies enhance patient care, training of physicians, and diagnostics in ways that we are only beginning to fathom. Thank you for joining us on this journey into the exciting realm of VR based telemedicine, and thank you for listening.